Welcome back to our Penfield Hope training. This is the second of 3 training parts for volunteers who would like to interact directly with clients in what we call a ministry of encounter. The most important part of your training will happen in mentor sessions with experienced Penfield Hope volunteers. You should complete at least one mentor session before starting part 2 and another before part 3.
The second part of your training is focused on the all-important skill of active listening. We focus on active listening as a way to achieve the mission of walking beside our clients towards family stability, especially in the area of housing. And how do we do this? First, we listen. We listen to their story. It is so important for each of us to share our story with someone who is really engaged in listening to us. Imagine asking for food or financial help. Listening is an essential first step in putting someone at ease. Second, we assure them of how we can help with any immediate, simple requests, such as food or diapers. Next, we try to move to a deeper conversation about where they are. What's the background? What does the next few weeks or months look like for them in terms of employment, expenses, benefits? How do they anticipate being able to budget to cover their expenses?
Listening is the most important skill our volunteers need to cultivate. It's a skill we all need to work on all the time. A difficult pattern for most of us to break is taking turns when we are in conversation. Think about having coffee with a friend. They tell a story. You build on their story with an experience of your own. They have a health issue, so do you. And back and forth it goes. With Hope clients, the focus is on listening to them. We want to refrain from interjecting with our own experiences. It also helps with active listening to be conscious of avoiding formulating responses in your mind while the client is speaking. Focus on what they are saying, the details, the tone of voice, the emotions, and try to stay in the moment so that you can actively process and gain insights and understanding. Some people will go on a bit. That's okay. You don't want to interrupt unless you need to clarify something that was said. Or maybe you recognize that the person has gone off on a tangent that does not seem relevant to the immediate issues. It's okay to gently refocus. We ask probing questions, so we need to be fully engaged in the conversation. This is hard work, but it is so rewarding.
Body language matters too. Some aspects of active listening have nothing to do with your hearing, but everything to do with your body language. Do you look like you're listening? Are you leaning in? Are you trying to make eye contact? Is your face expressing interest and encouragement? How about your voice? Is your tone patient, accepting, warm, welcoming? Your voice and facial expressions can telegraph where your mind is going. If you're getting distracted, or if judgments are starting to creep in, you might be thinking, "She looks well enough to work." "Wow, that was a really nice car he has." Or, "They're never going to help themselves." But as challenging as this may be, we need to be conscious of our own judgments and our own biases. Also, to avoid distractions, our phone should be turned off and out of sight. Nothing says I'm not really interested more than looking at your phone.
Once you've heard the client's story and given them plenty of room to say what they need to say, spend some time clarifying and reviewing what you heard. For example, "I think I heard you say that your biggest concern right now is," or, "It must be very hard to be in that situation. Are you a bit overwhelmed, or sad, or angry, or frustrated?" Or, "Let me see if I can summarize what you said about where you are today."
An important part of the Ministry of Encounter is going deeper. Going deeper can mean asking for more information than the client shares at first, but it's our responsibility to avoid just putting a Band-Aid on an ongoing problem. Initially, help the client identify how we can help today. food, diapers, toiletries, but then ask questions that get at how they might gain more stability in their family situation or finances. The goal is to guide them towards discovering their own solutions. We want to avoid jumping in to fix immediate issues without looking at the broader picture.
Going deeper can seem invasive. Sometimes it seems like we are getting very nosy, especially about finances. But the more we know, the more likely we can help in a constructive way, and the more likely we are to avoid a Band-Aid scenario. For example, if we can help someone with rent assistance this month, can they articulate how they will pay their bills next month? Can we help them budget better, get organized with bill payments, apply for benefits they might be eligible for? If they can work, are they actively seeking employment? Would access to a computer help?
So let's review the 7 skills involved in active listening. Be attentive and fully engaged. You're going to ask a lot of open-ended questions. You're also going to probe a bit, ask for information beyond what's being shared. Clarify anything that isn't clear. Take time to paraphrase what you heard. Observe the client's feelings and acknowledge them. Summarize how we might be able to help and any next steps they have.
We invite you to spend some time with this slide. If we're going to listen well to clients, we need to listen well to our own inner voice. Am I comfortable in this role? Is this a challenge I readily accept? What makes me uncomfortable about this? We invite you to go ahead and hit pause to spend a little time with this slide.
We've come to the conclusion of Part 2. Before moving on to Part 3, you have a few assignments. From the link provided on our Volunteer Hub, download and read carefully the Penfield Hope Policies and Procedure Guidelines. These are in place so we are consistent in our approach to clients. The most important part of your training is the time you spend with a mentor. Be sure to schedule your next mentor shift before moving on to Part 3. Kathy and I are eager to meet with you, so if you haven't yet set up an appointment with us, now is a great time to do that. And thank you so much for your time and your commitment to this training.